Newton with Inspire Movement Physical Therapy. We're going to show you a stretch here for the inside of the hips and the adductor muscles. Basically just like everything that runs down in here, that's what we're going to stretch. It is a very overlooked area, but it's critical to have this mobility for a couple of reasons. And I'll kind of talk you through why as we do it. But the main one is that having that ability of that ball and socket joint to kind of move out, right? If this is my, I'll do the other one. For my left side, to have the ability to do this is key to having muscles be able to fire properly. So what I would encourage you to do before even doing this is do something like a squat, do something like a lunge, see how well you do with that. Do this stretch and then go back to it and see the difference. It will be more than just flexibility being gained. You're going to feel your muscles engaging a little bit better too. So this is critical for anyone who has to get down on the floor, anyone who ever bends over, which is all of us, and also anyone who sits, which is all of us, and runners and other athletes. It's going to be big. So here, let's get to it and show you how it's done. First and foremost, we're just going to do something standing, okay? And this is really, really basic. You see this in the warrior poses in yoga. There are many ways that you can get after this, but basically just a straight up stretch. So I'm going to stretch my inner left side. So I just shift my pelvis and my weight to the right. I let this knee bend, and I just feel a little stretch happening in here. This knee can bend a little bit if you want, whatever makes you more comfortable. You can turn out, whatever you need to do. But then I just kind of take my hand on this outer hip bone and I just kind of nudge it inward like this. Okay? And I'm kind of pushing like that. I can also push in different directions, a little more forward or a little more backward. This is a little more backward. This is a little more forward. This is exactly what we do in the clinic here, folks, when we're mobilizing someone's hip. Again, ball and socket joint, and you're just kind of nudging it like that, like that, like that, kind of loosening it up a little bit. And that, like I said, will have the effects elsewhere in the body, getting other muscles to kick in a little bit better. So I can do that on both sides, and that's typically how you get more abduction range of motion, okay? The ability to go out to the side. That is usually where people stop. But I'm going to show you another part to this that is almost equally important. And for some of you, it's probably more important. You want to also have the ability for the hip to go out to the side at this angle of flexion, right? We talked about how in a different video we showed the pigeon stretch to get more hip flexion. Check out that if you're interested. This is the other side of it, okay? If you're having trouble squatting down, bending over, if you feel like the hips are just a little stiff, sitting, if you're having trouble with that, you need the ability, as we described in the other video, you need the legs to be able to bend upward. And sometimes they can go up and in pretty well, but it's that up and out that's kind of holding people up. So that's why this diagonal of mobility, this flexibility into this diagonal movement, kind of being able to bend up and go out, is very important and often overlooked. So there's no real modesty in this, and we're just going to get after it. So we're going to be in this position. Knees go out to the sides, because that's what we're stretching. And you just take those things out as far as you can. I like to have my feet turned out a little bit, kind of like in this froggy sit position. But I also realize that you got to do what's best for your knees. This might be a little bit too much for the knees. And if that's the case, I'll show you a standing version of this that you can do afterward. But if your knees can tolerate it, and you're not putting pressure on the kneecaps, and you're not twisting things to a painful point, you just go out to the side, and I'm feeling that stretch in here, and then you just let yourself kind of sink back into it a little bit, and then you can kind of bring yourself forward a little bit, and you'll find stretching at both ends of this, okay? Now, just like with, I think we described in the psoas stretch, the hip flexor stretch, you can do little oscillations. You can hang there, right? So coming back here, the oscillations look like this, or just hang here. But another great little technique is to engage your gluteal muscles, your buttock muscles. So let's say I want to be able to get more flexibility going back this way, the direction that we were just talking about. Right here, I'm kind of feeling it in my hips. That is the limit. So right here, I'm going to tighten both of my buttock muscles, and I just kind of hold here. Okay? And I just hold my buttock muscles tight. I'm going to do that for 20, 30 seconds, and then I release. Come up, and then I see if I can go back any farther, and you should be able to go back just a little bit more. We're talking tiny little bits of motion, but once you get up and try to sit and bend over, you'll feel the difference. So do a squat before you do this, do a squat after, you'll see. So I sink back again, tighten my buttock muscles. I can repeat this a couple of times if I want to, 20, 30 seconds. And then, like I said, I can also go to this other end here if I want to. We talked about doing this just standing upright just a second ago. So it's up to you how far you want to take this. I'm just giving you more options. If you can't get into this kind of froggy seated position, stretching up and out, you can do it standing as well. I just think that it's a little bit easier to cheat. That's why I don't give that first. But the way it works is just like how you see the professional athletes, doing a pregame warm-up. They just come down like this, and they keep their backs flat, and then they do the side to side on top of it. Okay, so and some of them even you'll catch them kind of pushing their leg there. So you can do this in a standing position as well. You've got kneeling and standing options for both of these stretches, but what it will give you is that ability of the legs to come out to the side. We're not trying to be super gymnasts, most of us, but having that little bit extra mobility is going to get better muscle function in the hips, and it's going to give you that extra flexibility that you need to do what you need to do.